Before your first symptom, before your first abnormal test, before anyone used the word heart disease in a conversation with you, something was already building inside of your body. Something that had nothing to do with your cholesterol, nothing to do with your blood pressure, something that conventional medicine has no protocol to test for, no medication to address, and no appointment slot to have that discussion. It has already been accumulating every single day. So look, I promise you by the end of this video, you're going to understand what that something is and why it has been invisible to the medical system and what you can start doing today to begin removing it from your body for the first time so that you can get to the bottom of your heart disease naturally. Because here's the problem. You've been taking medications. You've been watching your diet. You've been managing your numbers. You've been doing everything the system told you to do. And at no point in the process has anyone ever asked you if you've been exposed to something. What's been building up inside of your body? What has your body been trying to process and eliminate for decades without enough support to do it effectively? And look, that assumption has been that if your environment was the problem, somebody would have caught it by now. Somebody would have tested you for it. Somebody would have mentioned it. And that assumption has been costing you. So look, I started to notice something in my patients that didn't fit the conventional picture. People were doing everything right. Clean diet, taking their medications the way the doctors prescribed, yet their cardiovascular markers were still moving in the wrong direction. And when I started looking at what was happening to their cells, not what they were eating or how they were medicating, but what had been accumulating inside their bodies for decades, it changes the picture completely. Those same patients whose cardiovascular inflammation never responded to conventional treatments all of a sudden started showing measurable improvements when they addressed the load that their bodies had been carrying silently for years. So here's what I'm going to do today. I'm going to show you what is the burden that is actually in your body that has been making you lose the battle for cardiovascular disease and how it's been hiding in your day-to-day life in areas that you would have never connected to your heart. I'm going to give you something specific so that you can start doing it now and it'll begin to address your cardiovascular health immediately. Okay, so here it is. Point number one. Your daily life has been working against your heart long before your diagnosis was made. Look, most people with heart disease will tell you that they think they know what caused it. Too much of this wrong food, a family history with bad genetics, years of stress, not enough exercise. Because those explanations feel true because your doctors have reinforced them year after year. But what no one has ever suggested is that something in their ordinary environment that they've moved through every single day, the water they drink, the products they use, the air that they breathe, those were quietly adding to a toxic environment building up over time. Look, every year your body comes in contact with thousands of synthetic compounds that didn't exist a century ago. Pesticide residues on food, heavy metals found in our water, industrial chemicals in packaging, even synthetic compounds in your personal care products and in your clothes. These toxins begin to accumulate in the tissues, which is your organs and even the walls of your artery, often without symptoms appearing. And without those symptoms appearing, most standard tests miss them. And until inflammatory and oxidative damage is driving things where it shows up as something a doctor can measure, then you get a diagnosis. Your heart disease didn't start the day you got your diagnosis. It started earlier with the accumulation no one was paying attention to. And that process started in your day-to-day life long before anybody called it heart disease. Look, our ordinary environment is things most people consider to be safe, but yet it's been depositing cardiovascular toxic loads for decades. And that load is real. And by the way, it is measurable. And it has been contributing to the inflammatory and oxidative damage of your heart disease this entire time. Look, I started noticing something in the patients that didn't fit the conventional picture. People doing everything right, clean diet, medication compliance, cardiovascular markers still moving in the wrong directions. But when I started looking at what they were carrying, not that what they were eating or how they were medicating, but what they had been accumulating in their body for decades, the picture changes. Those same patients with cardiovascular inflammation that had never responded to conventional treatments all of a sudden started showing measurable improvements because they addressed the toxic load of their body that they've been carrying silently for years. So, look, when you accept that your daily environment has been contributing to your cardiovascular disease, then you stop looking at your cholesterol numbers. You stop looking at blood pressure. You stop looking at your medications and you start asking, what has my body been carrying that no one has ever tried to identify or eliminate? That is a completely different and far more complete question. But here's what makes this even more complicated than simply avoiding certain foods or switching your products. Your body has a system specifically designed to handle this burden. And for most people with chronic cardiovascular disease, that symptom has been losing the battle for years without you even noticing it. And look, that's point number 2. Your body was designed to eliminate toxins. But look, it can't keep up because most people assume that these toxins are being handled automatically. Your liver filters your blood. Your kidney clears waste. Your body has a detox system built inside, right? So if toxic accumulation were a real problem, then the body would deal with it. But your detox system was designed for a different world than we live in today. It was built to handle naturally occurring toxins at volumes that our ancestors would have encountered. It was not built for the volume, the variety, or the persistent synthetic chemicals, heavy metals, industrial compounds, microplastics, all of this stuff we find in medications that we see are characterizing today's modern environmental exposures. This creates a toxic burden that adds to cardiovascular disease because it feeds the inflammatory process that's already working against you. So your detox system isn't broken, it's just usually overwhelmed from such a long exposure that has been building up in places you can't see because no one's been looking for it. Look, supporting detoxification is not a wellness trend. It's not a cardiovascular intervention, but when your body's elimination capacity is restored and the inflammatory and oxidative load driving heart disease begins to decrease in ways that medication can never do, chelation therapy, which is one of the primary detoxification interventions that we use in our practice, has been used clinically for decades to remove heavy metal accumulation from the body. What I have observed repeatedly in patients who undergo comprehensive detoxification protocols is not just a reduction in toxic burden markers, it is a measurable improvement in cardiovascular inflammatory markers, energy changes, overall cardiovascular function improves. Because remember, your body isn't broken, it was just overloaded. So when the load decreases, the system starts working in a way that it was designed to work. And when you start supporting your body's detox capacity, you're not just reducing toxic burden, but you're directly reducing the oxidative inflammatory stress load that was contributing to the cardiovascular disease from the inside out. So where does toxic burden actually come from? Because the answer is not a single source you can simply eliminate. It's something that requires a completely different way of looking at your daily routine. So here's point number 3. Find out how much of your daily life is contributing to your toxic load. So the question now is how much of this applies to you specifically. Patients with significant toxic burden contributing to their cardiovascular disease almost always share a same set of daily exposures and experiences that no one has ever connected to their heart health. So let me ask you this. Have you ever lived or worked in an environment with significant chemical exposure? Maybe agriculture, manufacturing, construction, or you're working with older buildings with lead paint or lead pipes. Have you ever done a DIY job in your life? Do you regularly consume conventionally produced non-organic produce? Do you drink tap water? Is your food stored or heated in plastic containers? Or do you eat processed foods with significant chemical additives? Can you even pronounce the ingredients? Or do you experience symptoms like chronic fatigue, brain fog, unexplained weight gain, hormone disruption, alongside of your cardiovascular symptoms of blood pressure, cholesterol, triglycerides, palpitations, arrhythmias that has never been connected to heart disease? If you answered yes to 2 or more of those questions, there is a meaningful possibility that environmental toxic burden is contributing to your cardiovascular inflammatory load. not just as the only driver, but as a compounding factor that has been active for years and was never addressed. And a compounding factor that is feeding the problem regardless of how you manage everything else. Because here's what I've observed in practice that research is now confirming. You cannot fully resolve cardiovascular inflammation while the sources feeding the inflammation remain active. And for many patients, toxic burden is the active source, which means the next question is, what do you do about it? But before point 4, if this is opening a door that no cardiologist has ever opened for you, subscribe to this channel. Every single week, I cover the root cause side of cardiovascular and metabolic health that your conventional cardiologist isn't. So hit subscribe, activate that bell, and don't miss what's coming, because point number 4 is next. Your daily habits are either loading your system or cleaning it out. Okay, look, most people think about detoxing as something extreme, like a juice cleanse for 21 days or this massive supplement protocol that sends you to the toilet all the time. Something you do for a period of time, then you return back to normal life. The idea that daily ordinary habits are either actively loading your body with toxic burden or supporting its elimination is not how most people view their detox routines. Normal life is supposed to be a neutral baseline, but it's not. Every day, your body's either accumulating more than it can eliminate, or you're eliminating more than you accumulate. There's no such thing as neutral. The water you drink matters. The food quality matters. Your cookware matters. Personal care products matter. Sleep matters because your brain's waste clearance system only works when you sleep. So because every input that could increase toxicity load drives oxidative stress and inflammatory burden, remember, that hits your arterial walls. And every habit that you do that supports elimination will reduce that burden. Once again, this isn't neutral. Every single day, you're either loading your system or you're clearing it. And most people have been loading it for decades without ever knowing it. Reducing cardiovascular burden is not a protocol you do once. It has to be a daily practice of minimizing incoming load and maximizing outgoing elimination. And it starts with decisions that have nothing to do with your cholesterol or your blood pressure. So look, in my practice, when I work with patients with a structured detox process, it addresses both sides of the equation simultaneously. What I observe consistently is this: patients who make a specific daily habit around water, food, cookware, sleep, products, eliminating the toxicities in their life and supporting their elimination pathways through targeted nutrition therapies and things like sauna and chelation, they show cardiovascular improvements that medication cannot produce. Not because their doctor was wrong, but because the toxic load feeding the inflammation was never addressed, and it's now finally being addressed. So when you start treating your daily habits as either loading or clearing, decisions begin to reduce toxic burden that has been compounding your cardiovascular inflammation load for years. And that reduction doesn't replace treatment, it just makes everything better. So watch, what specifically can you do right now? Not a protocol, not a lifestyle overhaul, but something that you can start to address your toxic burden to your cardiovascular disease immediately. And here it is, point number 5. Tonight, start reducing the toxic load that's working against your heart and your body by eliminating toxic burden through several pathways. Your liver processes and neutralizes compounds for elimination, then your kidneys grab them and get them out of your blood, and your gut binds and excretes them through your digestive process. Your skin can even eliminate them through amounts of sweat. Most people with cardiovascular disease have not been supporting these pathways, not because they didn't know, but because their doctor didn't know. So tonight, you can start with 2 of the most important, measurable, and actionable areas so you can start to get forward movement. Think of your detox system like a drain that has been clogged for years, but just partly. Water will still flow through it, but it's slow. And anything that goes faster than it drains and it starts to accumulate. So what I'm about to give you is not a drain cleaner. It's the habit of keeping your drain clear and as clean as possible every single day so nothing accumulates and it certainly doesn't compound. Small, consistent clearing beats the occasional dramatic, heavy intervention every time. So these are two specific starting points that you can implement right now, and they will support your body's detox pathways immediately. Step number one, switch your water source now. Look, if you're drinking unfiltered tap water, you're only adding to toxic load with every glass. A quality carbon or reverse osmosis filter can remove a significant portion of the heavy metals and even the pharmaceutical residues that are found in most city water supplies. This is the highest leverage point because you can change it right now. And if you already have a water filter, just go to step two. Step two is increase your fiber intake starting now. Fiber binds to toxins in your gut and carries it out of your body before they can be reabsorbed. Specifically, add one of the following to your next meal: a large serving of cruciferous vegetables like broccoli, cauliflower, or Brussels. Maybe even ground flax seeds that you mix into food or water. You could even use a fiber-rich legume like black beans or lentils. This directly supports your gut's elimination pathways, which will start at your next meal. Okay, step number three. If you have access to a sauna, use it for 20 minutes. Sweating is one of the most effective pathways for eliminating certain heavy metals and environmental chemicals that your liver and kidneys struggle to get rid of. 20 minutes of meaningful sweat is a direct detoxification event. And if you don't have a sauna, check out my video on how to do an indoor sauna in your house, or maybe start with a hot bath that produces a light sweat. It can achieve a very similar effect. Okay, step number four. Right before you go to bed, 3 grams of high-quality fish oil. Omega-3 fatty acids directly reduce the oxidative inflammatory signaling that toxic burden produces in your cardiovascular system. And remember, this doesn't eliminate toxins, but it reduces the cardiovascular damage that they cause, while elimination processes can build the momentum. Step number five, write down the 3 highest chemical exposure points in your daily routine. Is it your cookware? Is it your personal care products? Is it the food storage containers? Maybe it's your clothing. These are your next targets. Look, you don't have to change them all tonight, but identify them, and that gives you a roadmap to reducing the incoming load over the next 30 days. And if you do these 5 things consistently, day in and day out for 30 days, you're gonna get a toxic burden panel run at the same time. At least you should. Then you'll have a before and after on the markers, and it'll tell you how effective has it been with you removing them, and it tells you more about what's driving your cardiovascular inflammation than any cholesterol panel has done ever. So look, your heart disease didn't develop overnight. It's been inside of your body, and it's been there invisibly for probably decades without you ever supporting it, because toxins are real. They are measurable and they're addressable. And reducing it is one of the most powerful cardiovascular interventions that is available that conventional medicine has never discussed with you. So now you know it exists, you know where it came from, and you know where you can start. And that changes what's possible for your heart health in a way that no prescription ever could. So look, if you enjoyed this video, make sure you watch the next one, which is on your screen now. It's going to change the way you view your cardiovascular health.